Hello, everybody. My name is Otis Nelson. I'm our Vice President of Sales and Business Development here at Lasso. And today I have the pleasure of Dr. Brady Smith joining us on today's discussion of growing your practice through charitable service. Dr. Brady, would you mind introducing yourself and telling the people just a little bit about you?
Yeah, thanks, Otis. Appreciate the invite. Thank you for having me. And I'm excited to talk about this topic. It's something that's it was eye-opening for me. But I'm a general dentist. I graduated in 2009 from the University of Pacific School of Dentistry, and I went into a franchise type of setup with an organization called Comfort Dental, which a lot of people I think might be familiar with. They're pretty heavy in Colorado, and so that's where I started from 2009 to 2014. And then I had an opportunity to move with Comfort Dental to the Pacific Northwest. And through a series of just different moves, we amicably split ways. And now I run two practices by myself with a partner, but privately. So I decorporatized dentistry in a rare, crazy plot twist. I decorporatized, took the practices that were Comfort Dental, and I arranged to buy them from them. And they sold me the franchises, so I took their name off and put my name on. And that was just last year that we parted ways. And so I'm a general dentist, do a lot of surgery, a lot of implant placements, a lot of extractions, but kind of a bread and butter type of dental office, group practice. And we definitely cater to a lower socioeconomic demographic. And I love it. I love doing what I do, and I love catering to people who definitely need the help. Yeah, is that good? Is that a good history?
That's
is
perfect.
that so far so good?
You know what? You saying it's like not a very unconventional approach. I love because it's more people going from, a private practice owner and then end up selling to like a DSO. And I think you're the first I've ever heard to say, no, like, hey, no, I want to take the practices from you and then,
Right.
decorporatize, which is awesome. The other thing I wanted to say too, now that I got you on here, totally unrelated. I love the melon hats. And I see you got your
Oh,
melon
yeah.
hats, and they are money. My family, we're big boaters. We're on the water and stuff all the time. And just to have something to floating after I get done surfing or anything like that, it's just amazing.
Peep the melon hat, man. I got like 6 of these.
Yeah, I think I've got about 4 or 5 myself.
And everyone I know that buys them has like 5 of them. They buy like tons of them because they float in the water. So if you're surfing, I surf too. So if you float in the water, if you do anything water related, and you want to wear a hat, it's just perfect because they float and it's awesome.
Yeah,
they're sleek. They have a great design too. They fit well.
They really do. And I feel like I always have to keep buying more because they come out with these new lines and new colors and stuff like that.
I know. It's an addiction, man. Melon hats.
It totally is. All right. Well, I'll get back on topic here, but you've done this, and you're really, from what I've been told, you're really, really, really good at it. And so I really want to talk about. I don't think people go this route very often, but I think it's very important to do so. So tell me what you've done and why you think it's important to doing charitable service and growing your practice by doing so.
Yeah. So I found out by accident, Otis. I found out, it was never my intention to be like, hey, I need to grow my practice. Maybe I'll start doing charity. That wasn't the way that I figured things out. But I did hit a roadblock in my career about 5. So the way Comfort Dental is a little bit different than most DSOs or most corporate offices, I think, because it's definitely owner operated. Like a lot of the autonomy that you would think you don't have in a corporate setting, you do have within Comfort Dental. You don't have complete autonomy, but you have a lot more than other places that I've seen personally. So I ran things myself. I hired, I fired, I bought supplies. I managed the office like a normal private practice dentist would manage their office. And about 4 or 5 years into being a dentist, I had to come to the harsh realization that I hated what I did. I didn't like it. I felt dread going into my office. I just was in a bad place mentally, and the money was good. I made good money, and so it wasn't lined up with money. I was like making good money, paying my bills, doing everything I needed to do in that area, but something was definitely missing. And dentistry is a difficult profession to like 180 and be like, well, I'm just going to not be a dentist now. Maybe I'll go be an engineer or something. You just can't really do that. And so throughout doing like what I call a personal inventory, I realized that one thing I was not doing was anything charitable, not just in dentistry, but like anything in my life, nothing. And that's the way most dentists would be. I mean, everything's about, I just graduated from dental school. My wife was pregnant with our first child. It was a little bit more about being a provider for my family, and that was super important. And so I just lost track of things that I knew were important to me that I wasn't doing. And so I started to do that, just little things. I'd do an extraction for free for someone, or they would come in for a couple of teeth to be removed, and I would do an extra one for free. Things that were just like not moving the needle for me very much, but would move the needle for them tremendously. A couple other things I also stopped doing dentures. During this whole like personal inventory time of my life, I stopped doing dentures because I identified them as the thing that I hated the most. And I know a lot of dentists, whatever that is to you, like that might not be dentures to you. It might be root canals or extractions to a different dentist. But for me, it was dentures. And I wasn't good at them, and I hated doing them. And so I stopped doing them. I just said, I'm not doing that anymore. And I made a couple other little changes too. But one of the big ones was charitable service. I started looking for opportunities to serve people. And I liked it. And my patients liked it. And patients were blown away when you would give them something, even a small thing, like an extra filling. And it made such a difference in my day-to-day. It was like a high that I would seek after. Like I would do more and more things. So I started doing like crowns or a root canal for free, and the way that I would phrase it was, I would phrase it very unassuming and it would be, you had to kind of disarm a patient because they always think you're up to something. But when I would say, hey, you need this crown, they're like, well, I can't do a crown. I can't afford it. I would say things like, well, why don't I take care of this one for you? And then you can take care of the next one. Or just something like that. And they'd be like, you would do that for me? I said, I would love to do that for you. It would be a pleasure to do this for you. I'm having, when you get another one, you can take care of the next one, but I got this one for you. I'm just really worried about this tooth. That's something I would say. And what I noticed was these people became very endeared to me and my practice, and became these incredible cheerleaders for me. And so I would do these cases and just small little things. And then eventually I got to the point where I was doing full comprehensive cases, start to finish, like pulling teeth out and doing implants, and I do it for free for people. But that's what happens when you chase it, right? Any kind of addiction becomes you have to get bigger and bigger and bigger to feel the satisfaction, right? And so in the context of charitable service, that's what I would chase. And then because once you're done with that crown, you're done, and that feeling's gone. Unless you can create it again. Some people get a runner's high. You go on a jog and you get a runner's high, and these runners go and they run, and then they're done, and they got to go again tomorrow because that's how they get their runner's high, right? So you chase these dopamine type of rushes, right? So that's what it became for me. And then what I noticed is by doing that, I would get to the point where I would try to do something every day, like something small every single day. And then over years and years of time, I accumulated a lot of cheerleaders, a lot of people. I mean, there's a lot of people who all of a sudden become big fans of me, right? And I am a very middle of the road dentist. I am not a clinical wizard. I would never put my clinical stuff out there to be judged by other dentists. I never would do that. I'm very average, I would say. But dentists, patients don't know about that. They don't care, and they don't care about that. They care about how you treat them, and they care about understanding why you do what you do. And so I just noticed a lot of referrals would come in from these people. And this started as very anecdotal for me. Like a lot of referrals would come in from this Jason guy And this Jason guy, I did a free crown for him. And all of a sudden he sends me his brother, and his brother's wife comes in, and his friend from down the street comes in. All these people from Jason come in, right?
Mm-hmm.
And it was just kind of like crazy how much word of mouth referrals I started to get by just doing little things for people. And so that was the start of something that clicked for me, that was like, wow, this might be the best thing I've ever come across. And I've never heard anyone talk about, any consulting group, any guru, any marketing wizard talk to me about, well, what are you doing charitably for people? So for me, it became, this is something that I'm going to pursue, not only for my own personal fulfillment, but also as a way to grow my practice.
That's really awesome. It's really cool to hear something like that. And I mean, it makes sense. I don't think, it was very outside the box thinking for you, and it just naturally and organically happened, by you doing that every day. I was going to ask you, like, how do you choose the patient? But it sounds like you kind of just do it for those who are in need, or for those that maybe you just feel the need to do it that day, or something like, hey, this person's been very loyal and I should.
Every dentist has patients in their practice that they like, that they get along with, that just can't afford the treatment, or choose not to do treatment for whatever reason. Mostly it's finances. That's really mostly the reason. So and you start talking, if any dentist is listening to this, they're thinking of that person right now. Oh, that guy's a cool guy. Or that girl, she's awesome. Mm-hmm. Man, if I could do something like this for someone, I know exactly who I would do it for. They already got that person in mind. And so you just do it. Here's what's beautiful, man. What's beautiful is that dentists can do this. Like, not all people in the medical health field can even do this. If you're a heart surgeon,
right,
you can't do this. You don't even own the cotton rolls in your OR, right? You own nothing except your skills. And so you are not the gatekeeper that opens up the gate for people if you wanted to help them out. Dentists are super lucky because we are the gatekeeper. In most situations, we can say, I'd like to do this for you. I happen to own the cotton rolls in my office. You know what I mean? Like, I own everything, which means I am the gatekeeper. If I want to give someone my resources, if I want to do that, I can do that. And dentists are in a super awesome situation for now, that we remain completely autonomous, that we can do that for people. It's such a blessing.
No, it really is. When you break it down like that, you're right. There's a lot of, providers out there that aren't able to do things like that. And the fact that you can, why not? Do you ever market any of this? Do you ever put any, things out on social media, or, stuff that you're doing or willing to do, to help out?
So yes, 100,000 times yes. Now this rubs people the wrong way sometimes. Mm-hmm. And by people, I mean dentists. Dentists, in my experience, so I run a charity called the Halo Dental Network. We work with dentists, and so through these experiences that I had, and these kind of epiphanies, I wanted to share this with as many dentists as possible, because this made a difference for me. I love my job now, and that's the biggest take home, is that I love what I do. I love going to work. I love figuring out, what am I going to do today to help someone else? And it made a complete difference in my whole personality, I think. I mean, it just really, my outlook on work just completely changed. But when I created the Halo Dental Network, it became important for me to share that with other dentists in a way that they could understand. And so we create video content of these people's lives that we change, and we tell their story. And, a story is no good if there's no one to tell it to, right? I mean, you really only inspire yourself if you do something for someone and only you know about it. But if everyone knows about it, then you inspire everyone to do stuff like this. So people complain about the news and the terrible, the whole media adage is, if it bleeds, it leads. So what do we see? Terrible news all the time. That's what sells. And this doesn't. It's not as sexy. But so in order for this to make impact in people's lives, it's got to be overwhelming. So we try to make content that shows exactly how the transformative power of dentistry changes and impacts other people's lives, because a lot of people don't know that about dentists. A lot of people still believe dentists are just drill and fill, clean your teeth, and they don't realize there's a major surgical component that changes the appearance of someone's face and our ability to help make people presentable, right? And through dentistry, you help people get jobs and find relationships, maintain those relationships, maintain those jobs. And you find people that lose all that because of their teeth, or they can't find that because of their teeth, is what prevents them. I mean, everyone has patients that they know don't smile with their teeth, because if they put that picture of them smiling with their teeth on their Tinder profile, they are getting swiped the wrong way. That is not going to happen for them, right? So they got to hide that from people, and eventually it comes to a point where you can't. And so you have people who are in people just lose their dignity, and to be able to restore that. And what's beautiful about the Halo Dental Network is that we found a way to make it so dentists don't have to pay anything, right? So all these amazing things you can do, these implant cases that you do, all on X, all on fours, complete reconstruction, full mouth restorations, full mouth rehabilitations. You can do it, and it doesn't cost you anything except for your time and your talent. And so it removes the impediment that most dentists would have about doing this. But the marketing, back to your question, the marketing, it's super important. It's super important, and it's not so much as it to generate leads. The marketing is important to tell people why you do what you do. Mm-hmm. That's what it is. How do you differentiate yourself from 12 different dentists that are in a 5-mile radius of you? Mm-hmm. Right? How are you going to do befores and afters on Instagram? Okay, because that's being done by at least 5 or 6 of the people who are within the 5-mile radius. Like, what are you doing to differentiate yourself? Do you feel good about helping other people? Is that why you got into dentistry? For a lot of people, it absolutely is why they got into dentistry. They got into dentistry to help people. Mm-hmm. And they found out quickly, you got to work hard to help people. It's not as easy come as you think it is when you start a dental school. It becomes, I got real bills to pay. I got a real life to try to provide here. And it's really difficult to be in that position of helping other people. And so the marketing is important to show people why. And when they see this content, this type of thing that you do, they figure out why you do what you do, and they want to be a part of that.
I agree. And I mean, you hit 2 things on the head for me a lot that really just resonate. One, being from a marketing company, that content that you're generating and, like just telling people like your why is very important, because, we're really big on video, and we talk about people telling their story and why they're doing what they're doing, why they want to bring people into their practice. And that is a great way to do something like that, on top of something that I've been preaching to, maybe all of my sales reps or anybody else that is new to the dental industry. You hit it right on the head. You really do change lives. And before I got into the dental industry 13 years ago, I really thought it was all drill and fill, right? Mm-hmm. I didn't really realize that so many people were afraid, and then they maybe get into a good experience with the dentist and now they're happy about it. Or like you said, they won't smile because it's bad. And you can almost see it in their face too. If I've ever seen any before and after pictures of things, like you can see people like smiling, and it's almost like they're embarrassed to smile. Mm-hmm. And then when they get their, full smile makeover or whatever it is, you can just see it. I mean, they almost glow afterwards. And so I really do appreciate you sharing that with us. And I think that any dentist listening to this should definitely take advantage of what Dr. Brady's doing, and, check out the Halo Dental Network, and definitely do some more charitable service. I mean, it makes me want to do more, now with Lasso too. But before I let you go, I wanted to run off of, for all of those that don't know Dr. Brady, he's very big on TikTok. And I want him to kind of share about what he's doing with TikTok and how it's been, it's changed for him, or do anything like that, just because I do think that it's going to be a platform that's going to be really, it's already one of the biggest URLs used, right? And sure. So moving forward, I think it's going to be pretty imperative for marketing companies to offer TikTok platforms for their social, other than Facebook or Instagram and that type of stuff. So can you share with us, before I let you go, just what you're doing in terms of TikTok?
Yeah. So number one, I don't promote my practice at all on TikTok. You will never see a post on TikTok for me that says, come visit my practice. So the reason I got on TikTok, I am part of a mastermind with a gentleman named Patrick Bet David. And we meet every month. And I was in a part of a mastermind to get consulting services through the mastermind group to grow the Halo Dental Network as a nonprofit. It's a 501c3, and I don't have a lot of experience with that. So I was looking to try to get with some really smart people. And when he saw it, and if you know Patrick Bet David, he has an entertainment company called Valuetainment, very much kind of like a lot like Gary Vee, if you're familiar with Gary Vee. He's been on Joe Rogan's podcast, so he's a big deal. And he saw my content and he said, you need to be on TikTok. And I was like, I don't think I have the body for that, Patrick. And he said, you got to understand. He's like, TikTok is the only platform where you can reasonably expect to make some content and have 80,000 people see it by tomorrow. And I was like, wow, that's true. Okay. So it's an algorithm that's based on merit, which is different than the algorithms that's based that Instagram or Facebook or other social media platforms utilize. Where if the algorithm knows that people are engaging with the content, if more people are engaging with the content, then it goes to more people who engage with the content. You can snowball that if you have content that's good and that people want to see. And he said, your stuff is good. You need to be on TikTok. So I was super hesitant, and then I got on TikTok. And within, I want to say 3 months, I had one video that had over 11 million views, one video that had over 6 million views, and a handful that crossed over the million view range. And so it was getting really popular and amassed a good following. But the whole purpose of that was for me to build the Halo Dental Network. And so now I use my TikTok as a place where, number one, it's entertainment. I try to entertain people. So here's what's interesting. What's interesting is that you can make a dental meme in 10 minutes. It's a funny little joke, right? Mm-hmm. And you might get 5,000 views on that little meme that you made, little funny joke. People think it's funny. I've given away a $50,000 dental makeover, changed someone's life, and seen it get 1,000 views. Like pales in a fraction of what something funny might get, right? Mm-hmm. And you start thinking about the psychology of the people who are scrolling. What do they want to see? Well, they want to laugh. They want to chuckle, and they want to chuckle in 5 seconds or less. That's what they want, right? So it's a little bit about the art of getting attention, right? Which I feel like for better or for worse, I have a knack for getting attention, and so I decided that my TikTok would be a lot of things that are funny, and the funny is just a bait and switch to get people interested in Halo. So, because if I only post Halo things, if I only post the charitable things, then it doesn't get as much engagement. It doesn't catch the algorithm. It doesn't get people's attention as much. And all at the same time, people know who I am. They get to know me. They get to know my personality. And I'm able to be authentic to myself on an app like that. So I've been really appreciative of that, and that's been really helpful. And I have gotten a lot of patients from the TikTok, even without trying. So if you're a dentist so I agree with you. If you're a dentist out there and you're marketing, you want to market your practice, and you're not doing it on TikTok, you're passing up a free opportunity to get your information out to millions, potentially millions of other people. It's not something that you should sit on, I think. If you have an Instagram, if you put the effort into Instagram or Facebook, you could, reap a lot more than what you're sowing on TikTok. So that's my plug for TikTok. It's been incredible, and it's a lot of fun. It's a fun app. You gotta, like any social media, you gotta measure out how much time you spend on it and how far you want to go down the rabbit holes of social media. But it's very good it's amazing for marketing.
Oh, that's awesome. Well, I appreciate your time today, Dr. Brady. That's the end of our episode right now, but I really do appreciate it. And I think everything you had to say, some dentists will really take something from that, whether it's growing through service or TikTok or whatnot. But appreciate you joining Lasso on our podcast today. And you take care, and I hope to see you soon.
Thanks a lot.